Welcome, I'm Dr. Brian Abelson. Today's subject is going to be lumbar spinal stenosis. I'm going to give you key points from a blog that I wrote, and I'll cover causes, symptoms, diagnosis, treatment, and exercises. If you'd like to go directly to the original blog, I'll provide a link below in the video description. And I'll also provide links to the videos that I've included with this blog. There's actually 7 videos in there. So let's get started. The symptoms of lumbar stenosis are actually quite interesting. Some of the symptoms are very similar to common low back pain. People will have pain sometimes down their legs, weakness, they'll have problems with balance. But the big differences are that people that have lumbar spinal stenosis, as they flex forward, lean forward, they feel so much better. If they go into extension, lean back, they feel really bad. There's something called shopping cart sign. You'll see people that are actually in a mall and they're barely not that mobile, wandering around, and they lean over, grab a shopping cart, and all of a sudden their mobility increases. Their low back pain diminishes substantially. You get a little suspicious when you start to hear this history. On examination, one really interesting thing is these people will sit down and I'll check leg strength, and they will get substantially stronger in a sitting position. This is not the case with people who are suffering from normal back pain. The causes of lumbar spinal stenosis are something we can actually deal with at a physical level. One of the causes is osteoarthritis. If we get the person exercising, get them stronger, this will give them better shock absorption capacity and can slow osteoarthritis right down to a crawl. Disc degeneration. For a lot of people, as they age, their discs get, when they were young, they were actually jelly-like and they were great shock absorbers. They got older, they're more like, kind of like burnt meat in some ways. They are really stiff and rigid. Fortunately, when you exercise, you get better fluid exchange and they actually become more hydrated, so they're better shock absorbers. Ligaments that are healthy are elastic. They actually stretch and go back to the original position. If a person's not exercising, they get very rigid and stiff. In general, inflammation is a major problem, but you can deal with this through exercise and treatment. I just want to make a few comments about treatment and exercise. When it comes to treatment, we want to make sure that we address both soft tissue restrictions and osseous restrictions. So we will actually use certain techniques for freeing up the joints, mobilization. I've given you videos in my blog that actually show you demonstrations of both osseous and soft tissue restrictions. Now, when it comes to exercise, actually we're giving you a video on that too, the 5 best exercises for spinal stenosis. But besides those exercises, you can take a look at it, and we usually tell our patients to do these exercises numerous times throughout the day. Aerobic exercise is critical. The research really supports the idea that if you get the person's heart rate up, you increase blood flow, and you help them in terms of better circulatory function and producing more energy, ATP, that they will respond. And these people have less of an incidence of spinal stenosis and less trouble with this condition. So please check out the blog. I'm sure you'll enjoy reading it. And if you have any questions whatsoever, just drop me a note. I'd be more than happy to answer them.